A recent study that looked at testosterone booster supplements found that only 20% of the ingredients in the testosterone boosters could actually increase your testosterone at all, and 10% actually decreased your testosterone. That is where this video comes in. I want you to be able to look at these testosterone booster supplements critically and say, will it actually increase my testosterone, and is it worth that high price tag? Or can we go another route and just get the ingredients that are in those testosterone booster supplements and actually just create our own supplement stack that will naturally increase our testosterone? So the first group of testosterone boosting supplements that we need to talk about is the group of supplements that will just raise your production of testosterone in general. So again, to go back to TRT, and let's explain why that has negative effects and why these supplements will not have those negative effects. TRT, or testosterone replacement therapy, just gives the hormone testosterone into your body, and it promotes increased muscle mass, the increased mood, the increased libido, etc. However, testosterone, when it's naturally created by your body, it comes from an axis of hypothalamus secreting something called gonadotropin releasing hormone, which goes to your pituitary gland, also in your brain, which secretes LH and FSH. And then these molecules go to your testicles, if you're a male, to produce testosterone. However, if you give then that external testosterone from TRT, that's going to signal to your brain, okay, we already have enough testosterone. We don't need to signal our testicles to produce more. Let's shut off the brain signal. So it shuts off the brain signal, and then your testicles now atrophy. They basically almost die off a little bit, and they can't produce testosterone on their own. Thus, when you come off of testosterone therapy, or TRT, it's going to be very difficult for your testicles to produce your own testosterone. And here lies the long-term adverse effect of being on testosterone therapy and coming off of it. However, these supplements that we're about to talk about are just herbal supplements that will increase your own body's production. It's unclear on the exact mechanism of all of these herbals in regards to where they increase it. Do they help your brain increase gonadotropin releasing hormone, or LH and FSH? Do they just help your testicles increase testosterone production? It's kind of unclear where they work on that axis. However, they help increase your own body's production of it. Therefore, when you stop taking them, it won't be a big deal, and your body will be able to continue to produce testosterone as it always has. So there's no negative side effects really of taking these supplements. They're pretty safe, but let's talk about, do they actually work? So the ones that I think have pretty good data, and kind of in order. First is one called Eurycoma longifolia, or Tongkat Ali, or Long Jack. There's a lot of names for it. This one I think has the best data. There was actually a systematic review and meta-analysis on Eurycoma longifolia consisting of 9 trials, and the dose varies from about 200 to 600 milligrams per day. But what they found was, on average, the testosterone basically increases by about 100 nanograms per deciliter. So a normal range would be about from 350 to 1,000 nanograms per deciliter. So increasing by 100 points for a natural supplement is honestly pretty good. Looking at one study specifically, just to dive into the dose and see the effect, they measured testosterone on about 25-year-old men, and about a sample size of 30 men were in this trial. What they found was, by giving 600 milligrams of Eurycoma longifolia per day for 2 weeks, they increased testosterone by about 120 points, which is extremely significant for a supplement. And when you start to look at these trials, what kind of correlate, what effect do we actually get from increasing our testosterone 100 points? Well, what you're going to see is it results in about a 1 kilogram increase in muscle mass over a multiple month period, which is a mild effect, but for a supplement is pretty good. And it also can increase your mood, etc. So a 100-point increase is no joke, and it definitely has some mild effect. The next supplement that I think has pretty good data is Fenugreek. Also in a systematic review and meta-analysis of 4 trials on Fenugreek, they basically showed the same thing as Eurycoma longifolia. It can increase your testosterone level, your total testosterone, by about 100 nanograms per deciliter. The dose on this is pretty consistent in these trials of about 600 milligrams of Fenugreek per day. Again, looking at one specific trial within this study just to get a general sense of the protocol in order to increase your testosterone with these supplements, they looked at a group of men, gave them 600 milligrams of Fenugreek per day for 12 weeks, and this increased their total testosterone by 124 points. So very similar to Eurycoma longifolia. And here is one of the studies that I was referring to. along with that 124-point increase in testosterone, we also saw about a kilogram increase in muscle mass compared to placebo, and also increased mood, etc. The next total testosterone increaser we have is Shilajit. Shilajit has a little less data than Fenugreek and Eurycoma longifolia. However, there are a couple studies proving positive benefit at 250 milligrams 2 times per day is generally the dosing for Shilajit. And you're going to see about a similar 100-point increase in your total testosterone. The next is a supplement called TesNor. And there's, again, similar to Shilajit, there's only a couple studies, but they are positive in regards to their effect on testosterone. TesNor, basically you have to do 400 milligrams per day, and you'll again see about that 100 nanogram per deciliter testosterone increase through this supplementation. The next total testosterone increaser is ashwagandha. So most people have heard of ashwagandha as an adaptogen or something that regulates your cortisol. However, ashwagandha also has direct testosterone effects, and not as good as the ones we just talked about. This is closer to a 50 to 75 nanogram per deciliter increase in your total testosterone. However, I would say pretty consistent in the few trials that measured ashwagandha's total effect on testosterone. However, since there is less data on ashwagandha's total effect on testosterone, there's also less data on the dosing. I will say for the adaptogenic effect, or for that cortisol effect, it's typically 300 milligrams twice a day of a typical extract of ashwagandha. So I would probably stick with that for increasing your testosterone through ashwagandha use. And finally, the last supplement that could increase your testosterone based on the science is betaine, or TMG. This one is actually specifically used in athletes who are training very heavily. There's only really 2 studies that I could find in regards to betaine and directly measuring testosterone levels. One was with CrossFit athletes, where it increased testosterone levels by only about 25 points, but still a positive effect nonetheless. And the other was on youth soccer players, an average age of about 15 to 16 years old, where it also had a mild positive effect on testosterone to cortisol ratio. Our next group of supplements for improving your overall testosterone levels is the group that will actually decrease the conversion of testosterone to estrogen. Testosterone is converted to estrogen through a process known as aromatization, and there's a lot of supplements that claim to inhibit that aromatase enzyme that does that conversion. So the supplements that claim to do this are really mostly a group of molecules known as polyphenols. Polyphenols are substances within plants that really have general medicinal properties, including having antioxidant potential, anti-inflammatory potential, etc. And one of those possible potentials is aromatase inhibition, which will decrease our estrogen, like we just said. So which polyphenols should you reach for this effect? Well, one is a flavonoid, or a specific type of polyphenol, and it's called Chrysin. So the thing about Chrysin is, if you actually look at the studies, there's not any human data on decreasing estrogen and therefore increasing our testosterone through Chrysin supplementation. However, there is some decent data on the basic science end, or basically in a petri dish or in animal studies, that show that Chrysin could decrease aromatase activity and therefore decrease your estrogen. However, kind of the jury is still out in regards to, does this actually lower estrogen? And then how about other polyphenols outside of Chrysin? Well, there's Quercetin, there's Curcumin, there's Resveratrol, all of which have potentially aromatase inhibiting properties. However, it's the same thing as with Chrysin. All of these polyphenols are tested positively in vitro. However, there's no human data to prove one way or the other. So I would use these ones sparingly. They do have great properties outside of their aromatase inhibition, such as antioxidant and anti-inflammatory potential, like we just said. So I think they're great supplements to take overall. However, for this specific purpose, I wouldn't go crazy. I think that there's a lot of other better supplements like the ones we just talked about that you could be taking. However, there are a couple other supplements outside of polyphenols that potentially could decrease your estrogen. One of which is zinc. Zinc is actually very important to not be deficient in if you want to decrease that aromatase activity. However, again, this is mostly studied in vitro. There's no human studies that prove that zinc supplementation will actually decrease your estrogen by decreasing that aromatase activity. The final supplement to talk about that can lower your estrogen levels is DIM, or diindolylmethane. So DIM is actually only partially an aromatase inhibitor, and actually the jury is still out if it even has that effect. it actually lowers estrogenic activity in other mechanisms. When your body is metabolizing and detoxifying estrogen, it shunts it down a pathway that is less proliferative, or the 2-hydroxy pathway instead of the 4 and 16 hydroxy pathway. The 2-hydroxy estrogens are much less proliferative, they have less estrogenic effect, and because you have less estrogenic effect, therefore you'll have, in comparison, more testosterone effect. This is really their main mechanism. However, DIM also decreases hormone receptors, and it decreases both estrogen receptors, and it can also potentially decrease testosterone receptors. So for this reason, I would actually be careful supplementing with DIM unless you have high estrogen. I wouldn't just go take DIM without having tested your estrogen and seeing that it's high, because like I said, it could have a potentially negative effect on your testosterone receptors. And if you don't have testosterone receptors, you're not getting the effect of your testosterone. There's also just much less data on DIM supplementation for improving testosterone versus estrogen levels in men. DIM is actually mostly used for women, especially women on HRT, because it inhibits the negative effects of that 4 and 16 hydroxy estrogens, which can promote breast cancer. So that's actually where DIM is mostly studied. So even though it potentially has that anti-estrogenic effect, I would only do it if you have high estrogen levels on your labs, because it could also potentially have a negative testosterone modulating effect. The next group of supplements to talk about in regards to improving your testosterone is improving your bioavailable testosterone, or improving your free testosterone. When testosterone travels around in the blood, some of it is free. And that free testosterone is what gets into cells and promotes improved muscle mass, etc. However, some of it is also bound up by a protein called sex hormone binding globulin, or SHBG. And there are supplements that promote decreasing SHBG and giving you more free testosterone, because if it's all bound up to that SHBG, then you're not going to be able to get testosterone into the cell and actually use it. So what's the supplement here? Well, boron, which is just an element, is highly studied for potentially decreasing SHBG. At 10 milligrams, boron supplementation actually has been shown to decrease SHBG, and then if you keep taking 10 milligrams a day, it's been shown to therefore increase free testosterone. On the other hand, if you only take 2.5 milligrams, they've done studies that show there is no effect. So the jury is kind of still out on it. I will say, I think at 10 milligrams, with the data I've seen, I think it does have a slight benefit in regards to decreasing SHBG and increasing free testosterone. However, this is not going to be a showstopper, and it's not near as good as the increasing the total testosterone effects that we saw on the previous supplements. The next group of supplements, and this is a very important one for optimizing your testosterone, is vitamins and minerals. Certain vitamins and minerals are used in all of the enzymatic processes that are used to increase your testosterone. One of those is magnesium. Magnesium has been shown to, through supplementation, actually increase testosterone levels. So how do you know if you need magnesium? Well, the best way would be to measure your red blood cell magnesium level. That's your real storage level of magnesium, and it's actually going to give you a better long-term evidence as to if you are magnesium deficient. I'd want to see your red blood cell mag up to about 5.6, and if not, I would supplement specifically with the magnesium bisglycinate form, which is the best bioavailable form and the best for this indication. The next vitamin to talk about is vitamin D. Vitamin D and being deficient in that is very, very linked in many studies to low testosterone, and the thing is, most people are deficient in vitamin D. I'd want your vitamin D level, if optimum, to be at 55 to 60. So get that checked, and likely you're going to need to be taking about a 5,000 IU form of vitamin D per day. Zinc, we kind of already talked about. That's a very important one to have up to par, especially if you are trying to inhibit that aromatase activity and lower your estrogen. And finally, the last supplement to talk about in this category is actually iron. So iron is a tricky one, because you don't want your iron to be too high, but you also don't want it to be too low. There's studies that have shown that if your iron is too high, you will have too much oxidative stress, specifically on your testicles, that will decrease your production of testosterone. So if you measure your iron and it's too high, and you need to probably do this in conjunction with a doctor, then you will need to take some antioxidant supplements. Actually, those ones we mentioned earlier that also have the potential to decrease estrogen. So quercetin, curcumin, great options here to decrease the negative side effects of having high iron, which will better improve your testosterone production. However, if your iron is too low, you also will need to increase that, because there's also been studies that show too low of iron is related to decreased testosterone. So what do I mean too low, too high? Well, ideally, you'll, like I said, get this measured with the help of a physician and kind of go over the lab work. But the one test that I really like here is ferritin, or your storage form of iron. And I like that to be about 100. If you're sitting down at 20, 30, I would definitely supplement with a little bit, maybe only 30 milligrams of like ferrous bisglycinate, and that probably would get you up closer to where you need to be. And then finally, just to mention here, because I see selenium in a lot of testosterone boosters, there's actually no tested association of selenium levels and testosterone. So that's one that I would stay away from if your main reason to take it is increasing your testosterone. Next are supplements that we can use to help our overall health, or to help our other body systems that are intricately linked to testosterone production. One such body system is your regulation of glucose. Insulin resistance is highly linked to testosterone deficiency. So we really need to make sure that you're metabolizing glucose in an efficient manner if you want to have optimal testosterone levels for yourself. I would test your hemoglobin A1C, and if you're really getting fancy with it, I would test your fasting insulin. If your hemoglobin A1C is above 5.5, I think you're going to need some help here if you want to actually get optimal levels of testosterone. So what I would do if your hemoglobin A1C is greater than 5.5 is supplement with Berberine. It's really our best supplement that we have on the market for decreasing your hemoglobin A1C or improving your insulin responsiveness. And this will definitely help you if you fall into this category in regards to improving overall testosterone. The next main body system to talk about, and truly every body system is linked to testosterone production. However, these two are just the most intricately linked. And the second one is cortisol, or your hypothalamus pituitary adrenal axis. So if your cortisol is dysregulated, studies again have shown that your testosterone will also be dysregulated and suboptimal. The best way to test your cortisol levels is a 4-point salivary cortisol test. Your cortisol varies very much throughout the day, and you're not going to know if you're dysregulated unless you actually look at the curve of cortisol production. We'll do a whole separate video on this to further explain how to know if you're dysregulated with cortisol. But if you do find out that you're dysregulated with cortisol, what should you do to improve that and therefore improve your testosterone production? Adaptogens. And we'll do another video on this in regards to which adaptogen will be best for you. However, just to talk about a few here. One, ashwagandha. So again, ashwagandha actually already improves your total testosterone in a mechanism outside of its cortisol lowering effects. However, if you have dysregulated cortisol, ashwagandha will be then a great selection for you, as it will both regulate your cortisol and improve your testosterone directly. So you're really going to get an improved testosterone effect with ashwagandha if you fall into that category. Another really good adaptogen is rhodiola. Rhodiola has again been shown to regulate cortisol, but it's also been shown to improve athletic performance, markers of fatigue in athletes, etc. So it's really an adaptogen that's heavily used in overtrained athletes. So if you find yourself in that category, rhodiola would be a great adaptogen for you. And finally, what are the supplements that you should stay away from? When you look at that testosterone booster, what are the ingredients that you see and you should just throw that back on the shelf? Well, there's a few categories of ingredients to talk about here. One is the aphrodisiacs, or the supplements that increase your libido, increase your sex drive. There's a lot of these supplements on the market, and they'll be included in these testosterone boosters. However, they have no data to prove that they will increase your testosterone levels, and actually they have data to prove that they will not. However, they will improve your sex drive, and there's pretty good data on that. However, if you're looking for the improved muscle mass, the improved overall mood, the improved bone density, etc. of testosterone, then these are not ones that you should be looking for. These are supplements such as horny goatweed, tribulus, and maca. All three of these don't have great data or any data for increasing your testosterone, but will increase your libido. The next group of supplements that are included in testosterone boosters are nitric oxide promoting supplements, L-citrulline, arginine, or just nitric oxide itself. beetroot powder, etc. The reason that they're typically included in testosterone boosters is that they will improve symptoms of erectile dysfunction. However, they're not going to increase your testosterone, so I would stray away from them for that purpose. And finally, when you're looking at those testosterone boosters and you're trying to select one, what is something else that you should stay away from? Well, it's the proprietary blends. When you see a testosterone booster that has no ingredient listed other than a proprietary blend of a bunch of ingredients, I would stay away because you don't know the correct dosing. You don't know if you're actually getting the 600 milligrams of Tongkat or the 600 milligrams of Fenugreek. Even if it has those supplements listed in the ingredients, they might be 100 milligrams and you might not be getting any effect from them. So I would stay away from any testosterone booster that is a proprietary blend, unless that proprietary blend is a studied supplement at a specific dose. So that is all the supplements regarding testosterone, estrogen, aromatization, SHBG, etc. What is my approach in regards to helping patients improve their testosterone levels naturally through these supplements? Well, first is blood work. I think blood work gives us a great baseline and helps us actually achieve targeted supplementation. So what blood work should you get? Well, I would get a testosterone level, obviously, your total testosterone. Then I would get an SHBG and an albumin, and that will help us calculate the free testosterone and your bioavailable testosterone. From there, I'd also get your estrogens, your estradiol and your estrone, 2 versions of estrogen. Then we can see if you need to supplement in regards to the aromatization inhibitors. And then I would also get something called DHEA and pregnenolone. These are precursors to testosterone that are created from your adrenals. And while they're not going to directly increase testosterone, they will improve symptoms of low T. So a good one to throw in whenever you're testing your hormones. Outside of this, then I would test all the nutrients that we just talked about. I would get a red blood cell magnesium, a red blood cell zinc, an iron panel. And specifically what I mean by that is a ferritin, an iron, a transferrin, and an iron saturation. And I would also, of course, get your vitamin D, as well as your hemoglobin A1C, your fasting insulin, and a salivary cortisol test. After that, I would sit down with your physician and go through those and try to figure out a good game plan. However, in general, this is typically my game plan with people who are wanting to increase their testosterone naturally. They have maybe a little bit lower testosterone on like the lower 400 side or high 300s. They don't want to do testosterone therapy, but they want to increase it naturally. Here's kind of my go-to method. One is I typically avoid testosterone booster supplements because, like I said, proprietary blends are a mess. I would stick away from those. Even if there's a lot of good ingredients, they don't typically have the correct dosing on any of them and maybe just one. So I would stay away from those and I would just get the actual supplements you specifically need individually. And here's how I would do that. First, I would pick either probably Tongkat or Fenugreek for increasing that total testosterone. They have easily the best data behind them and they probably are going to raise your testosterone 100 to 125 points. And that's pretty significant, again, for maybe even getting that extra kilogram of muscle mass over only a few months. Second, after that, what I would do is make sure your vitamins and minerals per your blood work are up to par. Supplement with the vitamin D, the mag, the zinc, the iron as needed. After that, what I would do is make sure your A1C is regulated. Get Berberine if you need to. Next, I would make sure your cortisol is regulated per your lab test. And typically, I'm going to reach for ashwagandha, given its also direct testosterone effects. But if you're an athlete who's potentially overtraining, Rhodiola would be a good option. And finally, I would look at your estrogens. If your estradiol is greater than 40 and your SHBG is greater than 55, what I would do is go ahead and reach for DIM. And specifically, if SHBG is high, but your estrogen is fine, I would go for boron there too at that 10 milligram dose. By doing this, you're gonna probably be able to increase your testosterone by about 100 to 200 points naturally, just with these supplements. And if you stop taking them, you can just go back down to your normal level and everything would be fine. And that's pretty significant. I mean, it is gonna only give you a mild effect though. It's gonna be 1 to 2 kilograms increased lean body mass over half a year, for instance. And it might increase your mood too mildly. So it's gonna give you a mild effect, which truthfully for supplements, that's what you can ask for. If you really want a moderate to high effect, what I'm gonna tell you is watch the next video on lifestyle changes, because that's really where we're gonna get this huge effect in increased muscle mass and increased mood, increased libido, etc.